this?
The T-wave.
Oh, that was from our chemistry class.
You don't need it anymore,
The
okay.
T-wave or
If
That
the
means
T wave
your
is
heart's not
missing, then it's
relaxing.
not repolarizing. Yeah, there's problems in the relaxation phase. So you predict if there's problem in the relaxing phase, you predict even the diastolic number is up already with your hypertension, right? Okay? So today we have a little activity. Before I forget.
They have all kinds of games where you can learn the veins. Online.
Next week she
You
wants
can match
us
the
to
veins to
next week.
it's on that purpose.com website. They'll give you like a body part, you choose it, and they'll have a whole list of veins, and then you can like match the veins to the arteries, or the names to the veins, or the names to the arteries.
No,
Another resource.
No?
To the test.
because we haven't finished the.
It's
You
not
don't
till
have
the
a test on
3rd.
Thursday?
We're not here Thursday.
Why are you not? Sorry, Wednesday?
Not until the
No,
3rd.
because we haven't finished.
Oh, it doesn't say in the schedule?
No.
That's next. The third.
It says February 3rd.
Oh.
Ooh, don't scare me.
I
I need to pass this one.
No,
No, we're supposed to have a lab test today.
Did
but-
we finish lecturing on the blood
You're supposed to
vessels?
have a lab test this week. Oh, no, no,
No, yeah, we haven't finished blood vessels yet.
no. So your next lecture test will be the rest of the heart and blood vessels, okay?
Are we gonna go over what's on the lab test so we can study?
Lab test? Were you not here?
There's
Oh,
no
you
lab
must
test
have been
until the
not
end.
here.
We're having one
Oh
cumulative
yeah,
lab
I
test.
know this. It's Monday. I'll be quiet.
Okay, I forgot this one. The cardiovascular system was one of those body systems that's scary or intimidating at first. That at least that's how I felt when I was studying it. And then once I got the hang of it, it wasn't really that bad. You need to know your anatomy to really appreciate what the heart and the blood vessels do for you. Like Lena just showed me her drawing. She forgot capillaries. So don't forget, we're studying our blood vessels. So here's right, your right atrium, left atrium, right ventricles, left ventricles. Okay, so you have sometime after the renal system, I'm going to have you draw the whole cardiovascular supplying different organs, and you will be able to do that. Okay, so we're going to include here the superior vena cava, right? There's your, and in the heart. So really, the superior vena cava and inferior vena cava, they look like this. See, they both just. So when you're doing your heart dissection, remember you were looking for. So the probe was like going through this, going here and going out there, and they just both empty into the right atrium. So this is the inferior vena cava, and then there's the coronary sinus, which is very hard to see. It's a very, very tiny hole, coronary sinus, but this is or coronary vein. Sinus is a vein. And they empty to the right atrium. They empty deoxygenated blood, right?
Coronary sinus.
It's the coronary vein. The heart, the circulation to the heart itself is called coronary circulation. We know that the heart is also made up of cells that need to be nourished, and that's the coronary circulation. From the right atrium, so as the P wave is stimulating this, it eventually contracts. It opens your AV valve, the right AV valve and the left AV valve. Remember what happens here is also going on here. So the blood here goes down to the right ventricle. From the right ventricle, it's going to, the pacemaker keeps moving. Now this depolarizes the QRS, and then this contracts to increase the pressure, which closes the AV valves, right, and opens this pulmonary valves. So this is your pulmonary artery. And the pulmonary artery is going to the lungs. Okay. To pick up oxygen. So in the lungs, oh, look. So this is an artery. The next one, how does it pick up oxygen here? Capillaries, right? It empties. So it will we have to include now our fine capillaries right here. So this is now capillary bed. Okay? And then this is your lungs. Are you following the picture? Does it make sense, everybody?
So the heart is the only one that's backwards.
The heart is
It's
the
taking deoxygenated blood via an artery
That's
and bringing
right.
it back
That's
via vein.
correct. Very good. So, in the test, I would ask you, arteries contain both oxygen and carbon dioxide. Yes, that's true. Veins contain both oxygen, yes, okay? So, please remember, we're studying our blood vessels. Look at veins, right? Veins return to atria, atria to ventricles, ventricles to normal blood flow, right? Artery, capillary. It breaks down into capillaries in your lungs, right? Because the capillaries are your exchange, right? You forgot that in your drawing too, Nina, okay? And so the oxygen enters my capillaries, right? And then it finally collects and becomes your vein, right? Arteries, capillaries, vein, pulmonary vein. So this pulmonary vein now is rich in oxygen. And this pulmonary vein is going to enter the left atrium. Right? So this is your pulmonary vein. I know my drawing is not that nice. And it's oxygenated blood, right? It's going to enter the left atrium. The P wave depolarizes this. You open it from left atrium to left ventricle. Okay? Then the QRS depolarizes this. You close that. This contracts, pushing the blood out to the aorta. This is my aorta. So in the aorta, the blood is oxygenated. And where is this aorta going to go? To the rest of the body, right? Look at this picture. So I'm just going to draw, going to the legs. I'm just going to go to the legs, right? So the aorta, remember the branches of the aorta? I know my drawing is not anatomically correct, but remember the aorta, the arch goes up, right?
Yes.
And then it curves down, the descending aorta, thoracic, then abdominal, everybody, yes, right? Then it's going to go down, 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 down. Still aorta, still large artery. It's branching into capillaries. As it goes down, so you're branching into, let's say, gastric artery, splenic artery, okay? You have your mesenteric artery, okay? And then, let's say in the gastric artery, it will branch into capillaries, right? That's how it picks up the nutrients maybe in your stomach. Gastric is stomach, so let's say stomach. Are you following, everybody? Then from the capillaries of the stomach, you return, join the inferior vena cava, that's a vein, right? Do you follow my picture? Then I'm going to trace it to the legs. This will explain about thrombosis, okay? So I'm going to trace this to the legs. So goes down to the femoral artery. We know where the femoral is, right? Right here. And it can branch all the way down to the sciatic over here, okay? The anterior tibial. So let's just, because this is the common site of thrombosis, right? Over down here. So let's go down. Let's say it goes down to the tibia part, the tibial artery, right? It's still an artery. Then after artery, how will it nourish my muscles here? Capillaries. You follow? So it will branch into capillaries, right? So capillaries, there's the capillaries. Let's say I have what do you call this? Varicosity here. So I ended up So after capillaries, veins. Yes? Right? So arteries branch into capillaries. That's how the oxygen is going to nourish my muscles down here.
Isn't there like arterioles and venules in between?
Yes.
Somewhere?
Yeah. So arteries to arteriole to capillary. Anyway, arteries to capillaries and veins. Very good. So now, so that's how I oxygenated my muscles. Are you following? Even though the picture is okay. So now look at the from the muscles. These are my muscles, right? My leg muscles. From the leg muscles, the carbon dioxide is going to enter the capillaries, right? To be returned back to the heart via my inferior vena cava. That's how it joins, right? Follow? So this is my femoral vein. So arteries, capillaries, vein, back to the heart. Look at this picture. Vein, big, right? The vein is big, back to the heart, big, 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 big. Where's the next branch of capillaries? The lungs again. Do you see that? Do you see, everybody? Do you understand this picture? This will explain. So look at, our most common site of thrombosis or blood clots is in your legs. And it explains it because it's going against gravity. It's very uncommon to have clots right here unless you have an aneurysm. There's an outpouching here. Then when there's an outpouching, there's a chance for a clot. But normally clots happen here, right? Because it's going against gravity. So the blood pulls down here, right? Pulls where? In the veins always, right? It pulls in the veins. And these veins are big. Look, I'm tracing it, tracing it, tracing it, tracing it. It's big, 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 big. Where will it encounter any kind of constriction?
In the lungs.
In the lungs. That's why a thrombosis that becomes an embolism, we always worry, or people will always complain about difficulty breathing. You should not forget this one. This always reminds me of our patient in Virginia. When I was practicing, a man came in, a long-time patient. He came in, he was sweating, had difficulty breathing. And a receptionist asked, "Are you okay, sir?" And he said no, and he dropped dead. It was an embolism. So he managed to drive himself. He should have driven himself to the ER. He managed to walk. We were on the 3rd floor. Walk, I don't know. Anyway, I'll never forget. But this, do you understand this picture?
Diabetics have that problem.
Yes.
It's how my grandmother died.
From embolism.
Yeah, she lost feeling in her legs for about 6 months and didn't tell anybody because she was afraid they'd amputate.
Oh.
And stood up one day and told my grandfather I need to go to the hospital, and died on the way. They found like 12 blood clots in her lungs because it just all broke loose and hit her
Yes.
lungs all at once.
Why the lungs? See, anatomically you can explain it. So that's what I want you to do with the cat. Just trace one. Remember, arteries branches into capillaries, then capillaries to veins back to the heart. That's the normal flow. So here, like in my internal organs, there's usually no clot that happens here. It's down here because it's really way down. It's having a hard time to go back up. So that's why it's very important for us to always be physically active. And this explains why in every gas station you have that picture of different kinds of exercises that they're telling you. It doesn't hurt you to stop for 5 minutes maybe. Do some stretching, some exercises. If I asked you, this was your activity today, I'm going to ask you, so this is your little activity. I want you to name those different blood vessels so that you can really, if you want to use your textbook to help you. Just always think, from the heart, it's artery, then it's capillary, then it's vein back to the heart, and then from the heart goes to the lungs. That's where your next set of it. There's always, you always think if there is a clot, it will plug where there is a small entry, and the small entry is always the capillaries. So you see, now it explains why a thrombosis always carries the risk of pulmonary, it's always pulmonary embolism, isn't it? They say pulmonary embolism. And that's why. So really, if you have old people, you want to make sure that they continuously are ambulatory. Like my mother, I want to make sure that she's always, I put the dishes way up, so at least she's forced to stretch. Any kind of stretching or any kind of activity, encourage it. I don't help her with her groceries. I want her to push the cart or whatever because I want her to be very mobile. Okay? You understand? Do you understand this picture? Even though it's ugly? You forgot your capillaries, right? That's the one thing you need to include in your drawing.
So they go here with the lungs and they go here at the bottom.
Correct.
And
So
then,
at the lungs, there's capillaries. At the
and
bottom,
then they go
in every body system, there's
At the
always
legs.
capillaries. Yeah.
Okay.
Going to your muscles,
And the
going to
arms
your
and the
stomach,
stomach and-
everywhere.
Mhm.
Very good. Okay? And you understand why thrombosis generally always happens down here, right? Because gravity. Okay? This one we usually always use, right? Say hello or whatever you do. You use it to eat. It's always being used. This one, even with the computer, you're using it. You're sitting down all day. Okay? So it's not only truck drivers that are at risk. We all are. Okay. So we're going to finish our we're going to finish our cardiovascular, your blood vessels. And then we're going to open up our cap. Look for a vein, please, and see if it's really sandwiched in between skeletal muscle, wherever you want. You want to use your leg vein, just look for one vein and see if it's in between. And it really is sandwiched between skeletal muscle. You can use this one, whatever you want. But I prefer you look for the vein right there because that's what's in your picture, right? And that's why we encourage walking among people, our patients. So that's why if you have AFib, you know the people on AFib, they have the risk of developing clots. We already discussed how they have that risk of developing clots, right? Did we? So that's why they're on blood thinners. Chapter 19. Where is Katrina? So the main function of the cardiovascular system, the reason why we have that cardiovascular system, do you agree, is so eventually so that our body is nourished. We need to get the nutrients that we just ingested. That's how we eat, right? We want to nourish our body cells, our tissue cells. And so that's why we have, and that's called tissue perfusion. It's called tissue perfusion, and it involves pressure differences. First of all, where does perfusion happen? It happens in your capillaries. And you have different types of capillaries. You don't have to worry about these different names of, is it too dark?
Yeah.
Yes?
See.
You don't have to worry about the names. Don't worry about this one. The reason why I want to show this is to so that you understand that capillaries are just one cell layer thick. They don't have smooth muscle. They don't have connect. It's just one cell layer. The layers are called tunica. So the inner layer, tunica intima. The middle layer, tunica media. The outer layer, tunica externa. You can just write inner, middle, outer. The inner, obviously, is epithelium, right? The middle is the muscle layer, and the outer layer is the connective tissue. So, look at capillaries is just the inner layer, and it's just epithelium. It's actually just simple squamous epithelium, the flattest type of epithelium, simple squamous epithelium. And look at capillaries have pores. See? And look at you have different types of pores. Sometimes they have spaces in between the cells. You don't see that in arteries or veins. Look here, even the cell itself, they have pores within the cell membrane. Here, combined pores plus spaces in between. That's how your hormones are able to leave, right? Or just think your liver. The liver receives the blood, and the liver is supposed to make your different proteins. How does it dump it back into the blood? It must have these kinds of openings. Do you find these kinds of openings in your arteries? No. Even the smallest arteries? No. The arterioles. You find them in veins? No. Only capillaries. Now the question is, yes, I know they have openings. How do substances move in and out? You remember that your nutrients, they don't have legs. They don't have hands. Like glucose, I don't ever see glucose with hands or feet that it can jump from one place to the next. Does it make sense, right? It must be pressure driven. The movement of substances into and out your body tissues must require pressure differences, right? So when you look at this one now, you're going to imagine this to have pores, to have openings. But like I said, let's say the glucose, the vitamins, the hormones, they're not amoeboid. So what will move them from here? So you know that you call this intravascular environment, or inside the blood vessel, right? Intravascular. And here in your tissue cells, let's say this is my leg muscles or whatever, my skin cells, this is called interstitial space or tissue space. Okay?
That's the space within the
Outside of your blood. Your interstitial space is your tissues, your body tissues, your muscles, your whatever. Okay? So, this what's flowing here, you call it blood. Right? That's what I call blood. And I just want to review, blood is made up of plasma, remember? The plasma and your formed elements or your cells. Okay? The cells are your red blood cells, your white blood cells, and your platelets. Okay? And then the plasma, you remember the composition of plasma? It's mainly water. Then you also have your so everything is here, right? Your water, your albumin, your globulin, your fibrinogen, my vitamins, my glucose, anything, bacteria, my hormones, they're in the plasma part. Do you follow? Antibodies, they're all in the plasma part. And we know that pressure, remember the pressure from the pumping, that's the one that's pushing all these components of the blood all the way to my capillaries. And look at by the time it gets to this arterioles, this must be the reason why the diameter of my blood vessels gets smaller and smaller, because you want to maintain that pressure. Does it make sense, right? By constricting it, there's still that pressure, okay? And so By the time you get here to the capillaries, that pressure is the key to push the nutrients from here to here. Does it make sense? Like your coffee, right? Isn't it pressure driven? It's the pressure that will push the water out of your filter. So I have to have normal pressure to be able to push these key substances in my plasma and push them out here to nourish my tissue cells. Do you follow? That's pressure driven. Now it explains the difference between hypertension and hypotension. If you're hypertensive, that's why it's called, what do they call it? A silent killer, right? Because even if your pressure is going up, at least hypertensive people still are able to push the plasma substances out to nourish their tissue cells. Does it make sense? But look at hypotensive individuals. If you're hypotensive, don't you pass out? Why do you pass out? There's no more pressure that's able to push my nutrients out. My cells suffer. I pass out. Remember, your gases are here to your oxygen. How can it be pushed out?
So with ketone acidosis, what's that?
We're going to talk about that when we study nutrition and metabolism. So many very, very interesting things about the human body, isn't it? But do you understand the difference between hypertension and hypotension?
So hypotension, your systolic blood pressure or your diastolic blood pressure goes up or down? Which one?
Both of them can go down.
Down.
Yes.
And then
Now, hypo means down.
hypertension, then your diastolic goes up, or both of them go up?
Both of them
Okay.
can go up. Very
Okay.
good. Can go up, right? You understand why? Which one then is more dangerous, hyper or hypo? Hypo. Very good. Hypo, right? We agree? Hypo is more dangerous. In fact, the symptoms, you feel it right away. But hyper, no problem still, because the goal, again, what's the goal of my cardiovascular? Tissue perfusion, to nourish. And when you're hypertensive, you're still able to nourish your tissue cells. It's just your blood pressure is high. That's the goal, to nourish it. You're still able to do that. But with hypotensive people, they're not able to do that. There's not enough pressure to push whatever is in here, push it out. Again, because these substances have no legs. They cannot move from your intravascular to your tissue space. They have to be pushed out. What pushes them out is pressure. That's why we want to look at these different pressure values. So this picture right here. Okay? So this is a capillary, and there's two ends to the capillary. This is the arterial end, and this is the venous end of the capillary, right? So there's my heart, the cardiovascular system, right? It goes heart, then from the ventricle you have the artery, becomes smaller, then this is the capillary, then this is the vein, it goes back to the heart right here, to the atrium. Okay? So, we know that normal pressure, 120/80, let's say. By the time you get to your tissues, look at. So there's a few terms I want you to know. Hydrostatic pressure. So you see this one, BHP. This means this is the blood hydrostatic pressure. This is your blood pressure. So the hydrostatic pressure always pushes out. So if you say blood hydrostatic pressure, look at the arrow. because I used to say, I don't know if I'll change my style, but in the past, I'll have a drawing like this, and I'll say, please write down blood hydrostatic pressure where you're supposed to write it. So you're supposed to write this BHP inside, and I'll say, use arrows to point to the direction of that blood hydrostatic pressure. So remember that hydrostatic pressure always pushes out. So when I say blood hydrostatic pressure, look at the arrow, it's pushing out. That's the pressure that pushes whatever is in the blood, it pushes it out. And look at this picture. There's also interstitial fluid hydrostatic pressure. So this is the pressure that's in my tissues. And look, it pushes out of the tissue. So it's pushing it from here to here. You see that? Always, hydrostatic pressure pushes out. When I say blood hydrostatic, it must be from the blood pushing out. When I say interstitial fluid, it must be from my tissues pushing out of tissues. So it's pushing it back into the blood. See? Just wherever it originates, that's where it's going to push out. Blood, it's pushing it out of the blood. Interstitial fluid, it's pushing it out of the tissues back into the blood. Then there's another type of pressure, osmotic pressure or oncotic pressure. Some books say osmotic, some books say oncotic pressure. This is the pressure that sucks in. This osmotic pressure, I prefer the word osmotic, whatever will work for you. This is because of the proteins they suck in. You remember your albumin? What's the function of albumin? For blood pressure. So, when you say blood colloid is the albumin, blood colloid osmotic pressure, look at, it's sucking it back into the blood vessel. That's the albumin. And if I say interstitial fluid osmotic pressure, look at, so this must be the proteins that's in the interstitial fluid, and it's sucking it there. Do you understand? So, let's look at this blood pressure. The blood pressure is called blood hydrostatic pressure. It's pushing it out. When you say interstitial fluid hydrostatic pressure, it's the pressure right here pushing into the blood vessel. Now we look at osmotic pressure. When we say blood osmotic pressure, that means the proteins in the blood sucking in the fluid. When you say interstitial fluid osmotic pressure, it must be the proteins here in the tissue sucking the fluid there. Follow? So osmotic, what? Attracts, right? And hydrostatic, push out. You just need to use arrows so that you're not confused.
So the blood colloid and the interstitial fluid OP are proteins going both ways?
Proteins, yes.
One's going to the tissues, one's going to the blood.
Yes. When you say interstitial fluid osmotic pressure, this refers to the proteins here
going in
push,
and out.
attracting the water.
And the other
here.
one is just the blood going in and out.
Yes.
The blood hydrotic is blood going to the
Hydrostatic.
tissues, and then the other one's coming from the tissues to the blood. Okay.
So I'm going to write down the components of blood again because what's flowing here is blood, okay? So I have my red blood cells, my platelets, right? White blood cells. And then what's in my plasma? My water, right? My albumin, globulin, fibrinogen. I have my gases here, oxygen, carbon dioxide, my nutrients, hormones, my vitamins, medicines, what else? Maybe germs, bacteria, what else? Whatever is in here, right? Maybe toxic substances, okay? So, what you need to remember that this except the water. The water is out. This one, the cells, the WBC, RBC platelets, and these big proteins, albumin, globulin, and fibrinogen, should never, except for the white blood cells, because they have that amoeboid property, right? They can walk out. But normally, they shouldn't be able to move out. In other words, the openings of even the largest capillary is not able to permit this WBC, RBC platelets, albumin, globulin, fibrinogen to leave your vascular system. The only way what white blood cells are able to leave, you remember, they change their shape, that amoeboid movement, they can squeeze out, they can, when they're called to an area where there's an infection. But normally, they should stay here. They keep passing through. That's very important for us to remember. Again, normally in any kind of circulation, remember the pattern? Artery, capillary, vein, back to the artery, in none of those patterns of circulation should this and this leave. White blood cells will only leave if there's an infection. Right? They can leave this one. So maybe we'll put an asterisk on this one. It's a special one. It has that property of walking. But normally, they will pass through.
So what's leaving if they're not leaving?
What's
then
leaving?
What's leaving?
They're here.
Well, what's leaving on the hydrostatic pressure
This
or whatever?
one. My water, my nutrients, my vitamins, my electrolytes, my medicine.
Why is there an
They-
arrow pointing to the tissues then, if there's no, on that first part, the interstitial fluid and the...
That's what's being pushed out. I just included this. What do you mean arrow?
Well, see, you
The-
said that there's
yes,
stuff leaving the...
Yes, they
hydrostatic pressure.
I
There's
know,
stuff going to
this
the
is what's
tissues. So
being
what's
pushed
going to
out.
the tissues?
This is what's being pushed out.
Okay.
This was not included in your picture. I just wrote this.
Oh, okay.
I see your confusion. I just wrote this. I guess I should have put this here, huh? Now you understand? I'm gonna, so what's being pushed out by this blood hydrostatic pressure? What's leaving? What's able to leave? My oxygen, my gases, right? My
Okay.
water, my vitamins, hormones, etc., etc. What passes through? Normally, my RBC, right? White blood cells, with
Okay.
an asterisk on white blood cells, yes? Platelets,
Can you just put nourishment and then what stays? is
albumin, globulin, fibrinogen.
Oh, okay.
Do you
And then
have-
the only thing is the proteins on the other, for the osmotic
They
pressure.
Very good.
It's just
the
proteins.
protein here, this albumin is the key. Okay? This is the key. Look at. So, they keep passing through. Why do they keep passing through? What did we say? The pores or the openings in the capillaries are not that large to permit the exit of any of these. How do white blood cells move out? They're able to squeeze out. If you need them, if you have an infection, they're able to squeeze out. That's why you have an asterisk there. They're special. Okay, they're special. They ride the special bus. But the others, they have to stay here. And why? Because this albumin, what's the function of albumin again? To maintain blood pressure. That's the one that you see this blood colloid osmotic pressure. Oh, here, blood colloid osmotic pressure. You see that one? That's the one, the albumin, as it moves here. Look at, this is the vein that's going back to the heart, right? As this albumin moves here, it's the one that will suck the water back. Because the cardiovascular system is a closed circuit, remember? We need to maintain the pressure in there. Is it better?
sucks back into the vein.
Yeah. So now you understand why people with Protein deficiency, malnutrition. You see them with protruding bellies, right? Because they don't have any protein. So they're deficient in protein. They must be deficient in albumin to suck the fluid stays here. Even people with liver failure, it's called ascites. I know you know that term, right? It's fluid in your belly, ascites.
How do you take care of that?
How do you take care of ascites?
You have to get it pumped out.
Fluid in the belly. How do you take care of that? What do you, water pill, you give them diuretics, right? You try to increase. But you know, that's the thing about, we talk about the most common cause is liver failure. This is the danger.
Dialysis.
Dialysis, yes,
The
very good.
intra-abdominal.
Very good. And also, you want to increase their protein because that's the key, right? But the problem with liver failure is their liver is damaged. And the liver is the key to processing the proteins. We're going to talk about nutrition and metabolism. Liver failure is one of those sad stories in the life of, because if it's failing and it's the site to make proteins, you cannot overload. You can't just liberally give a patient lots of proteins because you're so zealous in trying to correct this problem. That's why people with a malnourished individual, don't you nourish them very, very slowly, because everything is shutting down. Their liver is the key for making this. You're going to see that when we study our digestive system. So for now, do we understand this picture? Okay? So you understand these values. In the past, I used to give values, blood hydrostatic pressure, interstitial fluid, all of these values. And I ask you to compute. Compute for the, it's called net filtration pressure. So can I erase these things over here? Let's look at how they came up with this value. Look at this one. So here, the blood hydrostatic, the net filtration pressure, do you agree? The blood hydrostatic pressure plus the interstitial fluid osmotic pressure, they're both moving the fluid out. So look at the interstitial fluid osmotic pressure are the proteins here, right? That's sucking the fluid out here. So the direction of flow is both out. So that's why the net filtration pressure is this 1 plus 1. 35 plus 1. You understand this? Minus, look at, minus the ones opposing it. So the blood colloid osmotic pressure is opposing the exit of the fluid, right? So this 1 plus the interstitial fluid hydrostatic pressure, which is generally 0. So you come up with a net filtration pressure of 10. I usually put whatever numbers I want, just so I know that you know how to compute. So this is a positive number. My next question will always be, where will this be normal, in the arterial end or the venous end? If it's positive, that is normal in the arterial end. You want positive pressure to push the nutrients out of the arterial end of your capillary. Yeah.
Venous end would be the negative.
Correct. So once I have pushed my nutrients out, now I have pressure to push the nutrients. I was able to push my gases, my glucose, vitamins, water, etc., etc. In the meantime, what keeps moving? What keeps moving? Your RBC, right? Your white blood cells, your platelets, your albumin, globulin, fibrinogen. They keep moving. They are locked in your cardiovascular system. You need to write down in your notes, nowhere in any part of the body, nowhere should this albumin, these key ingredients, globulin, fibrinogen, RBC, platelets, white blood cells with an asterisk on the white blood cells. Nowhere in the body should they be able to escape the capillary system. But we put asterisk on the white blood cells, we understand why, right? They're able to move out by they will change in shape to be able to be squeezed out. But normally they should be here. Especially this one. Right? If you have proteins in your PP, that's a sign of renal failure. That means that the capillaries in your kidneys are damaged. They have a break. That's one of the things that
Or you're
will happen.
eating lots and lots of protein.
Yes, or most commonly hypertension. Does it make sense? Don't you think so? Just think, if the pressure, why do we worry about hypertension? If I said with hypertension, you're still able to nourish your body system, why do we have to worry about hypertension? Don't you think that if the pressure gets too high, that may break your capillaries? Don't you think so? It will break it to the point where this all of a sudden will spill. And that's how they end up being present in your urine. They shouldn't be. That means the capillary system in my kidneys have been broken. It's broken wide open. What breaks them wide open? It must be pressure. Does it make sense? You understand?
Causes nosebleeds.
So the net filtration should be negative on the venous end.
That's very
So
good.
it's going out. Does that make sense?
No, it's
Or-
going in.
Or in, out, whatever, going back the other direction.
Yes, that's right.
Otherwise, if it's
So-
positive, then it's not going where it's supposed to go.
It's still stays.
Staying there. Okay.
So we compute here. By the time the blood reaches your venous end, we compute for net filtration pressure. So here the blood hydrostatic pressure goes down. Of course the pressure goes down, right? Because I pushed out the main volume here, which is water. I pushed it out. So the pressure goes down. Plus that interstitial fluid, the interstitial fluid osmotic pressure of 1 minus. Now the blood colloid osmotic pressure is high, right? See, it doesn't change. But comparatively speaking, see, it becomes high now. The proteins stay here. So 26 plus 0, so you have a net pressure of minus 9. So a negative pressure is normal in the venous end. That's how you suck the fluid back in. That's how you keep them inside your cardiovascular circulation. You have to bring them back inside. Because why? It's a closed circuit and your cardiovascular system is pressure driven.
High resistance would increase.
High resistance where? If there's high resistance, like right here,
Yeah.
if you have high blood pressure, if you have high blood pressure, I'm predicting that may even break this even wider.
So that
The pressure is very high. Won't that even poke holes in your hose, right, eventually? So first it will thin out the wall here and then it may burst it open. So that's how the proteins here end up being here. And that's what happens with alcoholics or with renal failure. It just spills in your urine, it spills in your body tissues, and along with that one, you start having that typical fluid in your belly. You know that there's already damage here in your capillaries. You understand this computation? If I ask you to compute, do you understand the significance of this one though? Why we're studying it? See, just looking at it, looking at the picture, now it explains why your patients should be very religiously taking their blood pressure pills. because this capillary is very fine. It's just one cell layer thick. And you already begin with a very porous capillary. That's your starting. It already has holes. And if there's too much pressure, you're going to push those holes even wider open. And if they become wider open, all of a sudden, your precious albumin, right, will spill here. How are you going to return the fluid back there? No way. Okay?
I have a question.
Yeah.
On our worksheet, it talks about colloid osmotic pressure.
That's the one. This one, colloid osmotic pressure.
It's the same formula. I think
What-
there's a page in the book. Yeah.
Yeah,
Page
see,
219 shows you how to.
Interstitial fluid colloid osmotic pressure is this one. Interstitial fluid. So
Okay.
they just
they just added an extra
the
word.
letter C, the colloid, to I guess to remind us that it refers to the proteins.
Okay.
And that would be a -7? Is that what?
Huh? I don't know the value. What is the value?
It's
Do you have to compute? So
hydrostatic pressure is 30. The interstitial
let's
fluid
compute
hydrostatic.
that one. So what does it say? The blood pressure,
Yeah, the capillary hydrostatic pressure is 30.
30.
The interstitial fluid hydrostatic pressure is 0. Capillary colloid osmotic pressure is 25. And interstitial fluid colloid osmotic pressure is 2.
Okay, so the blood hydrostatic pressure is going out, right?
Yep.
And then this one, opposite, the blood colloid osmotic pressure, this one, interstitial fluid colloid osmotic pressure out. So 30 plus 2, right, minus 25 plus 0 is
7.
positive 7, right?
Yeah.
It's positive
It's
7,
7.
which should be normal in the
Arterial.
arterial end. Very good. Don't forget to write to write negative or positive so you don't make a mistake.
For those choice.
So that's the thing about fluid overload, okay? We don't want to drink too much water. We don't want to overload. It's just like the Starling's law in the heart. This Starling's law applies in any blood vessel. So you see, to a certain extent, always, to a certain extent, you can increase the volume, but then there's always a limit. As far as the capillaries are concerned, I know you know the danger, right? Because you already have, it's very fine, it's one cell layer thick, it's already porous to begin with. You increase the pressure, you're going to increase the space in there. And you need to preserve the proteins here because that's the key to suck the fluid back here, return it to the heart. Make sure you have a constantly flowing blood to push in your cardiovascular system. Okay? So, what maintains normal blood flow? Your your nervous system and your endocrine system, right? You remember in the medulla you have your cardiovascular center. So you have your receptors there. You have osmoreceptors and baroreceptors that detect changes in pressure and protein composition that then modifies blood flow and blood pressure. See how important the nervous system is? Even look at, this is just a review, remember? You have your baroreceptors immediately out there in the aorta. Your baroreceptors, you have chemoreceptors. That's how you adjust the blood flow. Why chemoreceptors? Isn't that what you want to nourish your cells with oxygen? Carbon dioxide has to be picked up. So all of these different chemicals and blood pressure differences are being monitored by your cardiovascular system so that blood pressure is regulated. There's so many hormones. We talk about endocrine regulation now. There are many hormones, not many, but there are several hormones I know that you can think of that corrects low blood pressure. You see? Because between hypotension and hypertension is more life-threatening. The symptoms are very quick, they're immediate, right? With hypertension, like I said, a lot of people are not even aware that they're hypertensive. Or you forget to take your blood pressure pill, you're still okay. But hypertension is more life-threatening. You just saw it. When the blood pressure is low, how can you push your nutrients out? So that's why there's several hormones. Can you think of hormones? Blurt out is a game.
Aldosterone.
Blurt is a game. What?
Aldosterone.
Aldosterone. You know the activity of aldosterone, right? What does it do? It helps to retain salt. And salt attracts water. You maintain blood pressure. What else helps with your blood pressure if it's low? I thought there's several hormones. There's how?
Angiotensin.
Huh? Angiotensin? Yes, that's another hormone. We're going to talk about that in more detail when we study your renal system. It promotes vasoconstriction. So if your blood pressure is low, vasoconstriction, that will help bring up blood pressure. What else? I'm thinking antidiuretic hormone. Doesn't it help, right? So antidiuretic promotes conservation of water. That helps in bringing back the blood pressure. Your adrenaline, norepinephrine, they promote vasoconstriction. There's a problem. For hypotension, for hypertension, there's only one. Atrial natriuretic peptide. And I always remember this one student of mine, she said, maybe because God didn't design us to become hypertensive. And she also said, maybe because God didn't design us to become stressed out. So there's only one, that atrial natriuretic peptide.
That's for hypertension.
For hypertension. That helps us.
Can we spell that?
So let's look at this one. Atrial. Natriuretic. Meaning for diuresis, natriuretic peptide.
That's the one that your atriums pump out when it gets stretched,
Correct.
right?
Very good. The one that I sent a message to everyone, right? So, when there's an increasing blood volume that enters your atria, the atrial wall expands, of course. So the cells of the atria make this hormone, and then they release it to go to the kidney. So you get rid of sodium. Along with sodium, water follows. That's how you control hypertension. That's the only one that helps you naturally. And because there's only one, it's very hard to control it if we aggravate it, like we eat very salty foods or high fat, right? That can cause any constriction.
Would that be
So-
triggered with somebody who had that disease where they overdrink?
Alcoholism.
No, water. We had a patient gain 13 pounds while he was in the shower. He drank 13 pounds worth of water.
Really?
Yeah, and for like the next day, he was on a fluid restriction. I mean, he wasn't given hardly any liquids, but he was peeing huge
Yes, it
quantities
will
of
be
water.
triggered, yes. Is it called
Polydipsia.
diabetes insipidus?
Oh, he's not a diabetic.
No, it's not. It's just called diabetes.
Is that might be?
insipidus.
They just called it polydipsia,
Yeah,
but
polydipsia, but it must be. Diabetes insipidus is totally different from diabetes mellitus, and I think the word diabetes just means peak. I'm thinking, I don't.
He might. I'd have to look at his chart again, but I don't think that's the diagnosis. It's a
Oh.
psychological thing with him.
Oh, wow. But that is.
Yeah, it was
what's going
13
on.
pounds from the time he got like an hour before he got out of the shower, like an hour after he was out of the shower. It was 13
dangerous.
pounds.
That's dangerous.
It was crazy.
That's why when you want to lose weight, don't you? I remember my husband in the army. Before he weighs in, he drinks all of those diuretics, so he lose however many
The water
pounds.
weight.
Yeah. You understand this atrial natriuretic peptide? Only one hormone. So that's why hypertensives, you have to give them medications, help them with their high blood pressure because we only have one drug, one natural defense against hypertension, which is just this one. Okay? So that ends our study of the cardiovascular system. Do you have, is it Confucius? Do you have any questions so far? So look at this picture. Please look at this picture. Always look at arteries. See, that's the artery, capillary. Go to the legs, capillary. Then veins, back to the heart. Look at big, big, big vein. Then go to the right atrium, right ventricle. Go to the lungs. That's where the next set of capillaries comes. So from big, if you have a thrombosis here, no problem. Big, big, big diameter. No danger of encountering an area of constriction until it gets to the lungs. That's the first. That's why we worry always about pulmonary embolism. That's why it's always called pulmonary embolism. Okay? So let's have a break for 5 minutes.